I had this feeling of like I broke out into a sweat, and I had like chills. Okay, Christina, I had like chills. I was freaked because I know that I had been stitched up and all that. Oh, it didn't happen to you, but you've heard it happens. Okay, it happens to some people, and for some reason she said she told me, but I couldn't remember. My mind was going far. I was like, hey, I've gone and gotten a uterine infection or something. Like, my mind was really going far. But the thing is that if you check your temperature will not be raised. So what I'm talking about is that you'd have bought your baby things, right? In your baby thing, there's actually a thermometer for the baby. You can use it as well, Okay, so we have 2 people didn't experience it, and then 1 person did experience it. So did, and my friend did. It was so you check your temperature. If your temperature is 38 or more, okay. So Chuku Christina said that she told her wife, and she gave her some drugs and said something about cold in pregnancy that probably is part of. No. unless you're actually having a fever. Was high, like 38. That thing is normal. It didn't even last for more than a day. There was nothing wrong with me. Everyone was like, I told you. And I was like, babe, I don't remember that. So all those things is hormonal. It's like a hot flush. Women who are experiencing menopause experience that kind of thing. It's like the hormones are just they've caused your vessel to what they call vasodilators expand, and then there's like a rush of blood. That's why you feel that way. So the only thing that shows that you have a fever is actually checking but I was freaked out. And there are a lot of things that they don't teach you in medical school. There are things that is only maybe midwives that know, or you have to experience. When I had my baby, I just realized that sometimes we don't know what we're talking about. No, not that we don't know what we're talking about, but the things that women experience in after they've had their babies that have not been documented. so it's very good to keep a diary. Yeah, so if you're experiencing a fever that's like 38 degrees or more, that's a bad sign. So that's about lochia. Another thing about lochia is that if you're breastfeeding your baby, at the time when you're breastfeeding, it will gush out. Your womb also contracts when you breastfeed, so you can have a gush of blood. Don't be scared. It's just your womb contracting. What else again? If they tell you to relax and chill and all that after you've had, don't hear word. You can be lying down. You can get up from a lying position, and then the gush of blood is normal. Sometimes has gotten to the yellow stage. That's a lochia serosa, and then maybe they went on a walk, or they stressed that not a walk, like maybe they had to do a number of things around the house and all, and they now start seeing the red again. It's your body also warning you that you should chill out, but it's also normal. So you can have that redness if you exactly. I'm saying that there's not something you need to be here at Anita. It's my Anita experience, but there's a lot to learn. Yeah, so it's a sign that you need to anything bad has happened, unless, like I said, you have that thing of like your pads being soaked within an hour, every hour. That's a bad sign, because for some people, I've had a patient come in who had what they call secondary postpartum hemorrhage, where for some reason they were retained. Part of her placenta was still. She didn't have her baby in her hospital anyway. Was still in her womb, and it wasn't until after about like 4-5 weeks after she had her baby that she started bleeding again. So we had to. She was brought in. She was bleeding very heavily, and all that, and we had to do a scan and check out and all that, and then we had to take her into theater to now do what we would call a manual vacuum aspiration. What would happen if somebody had a miscarriage, just trying to suck out what's left in the womb and all that. And she was fine immediately after, like a few hours after, the bleeding sort of tapered down. So those are the things to think about. Another thing I forgot to mention about the things that can cause excessive bleeding right after you've had your baby, like full bladder. If the times when we had moms, they've delivered, and for some reason their womb is still soft and flabby, and we don't want the womb to be soft and flabby. We want it to be contracted. If the bladder is full, the womb won't contract the way it should. So when we put a catheter in and drain, even sometimes when the baby is coming out, that can also be a hindrance. Put a catheter in and drain, and then the womb contracts. Another thing that can cause very heavy bleeding is ruptured uterus, which could have happened to the lady I talked about, who had a big baby and was and had a previous CS. I talked about cuts in the womb, in the cervix, in the vagina, and the area around the vagina, the vulva. Okay, so now we've talked about Lucia. So going to constipation. Yes, that's another thing that I didn't know about. I didn't hear about. I found out when you too late. So constipation after you've had your baby. So there are several reasons why you can get constipated. One, you're not taking enough fluids, and for some reason, sometimes people don't know about this, in the sense that, especially if you are breastfeeding, you're actually losing a lot of water. You're losing a lot of water, and the way it goes is your body provides for your baby more before you're like an afterthought. So if you're not drinking enough water, then, and you're losing also a lot of water from your breast milk. I mean, breast milk is like about 50 or 60%. The food in your gut is going to also, the water is going to be absorbed out as well. Another thing is that a lot of times also people are scared after to poo, because they are worried that, especially if they had a tear that has been repaired and a episiotomy, that they're going to rip the sutures. Okay, if you have constipation and you're straining, yes, you can put pressure on the sutures. But let me tell you something. Let me give you some news. The more you delay that visit to the toilet, the harder it's going to get when that poo finally comes. So if you need to poo, there's poo in your rectum that needs to come out, and you don't go to the toilet, the body will absorb more water from that poo. So there's more poo from what you're eating coming to meet that one that you've left there, and it's getting harder and harder. Okay, there's someone didn't poo for a week. It's getting harder and harder. My sister, please be guided. Be guided. There are ways around it. The constipation can affect your stitches, and then also you're not going to be comfortable at all. And if you have hemorrhoids, which I'm going to talk about later, constipation will make hemorrhoids worse. So what do you want to do? You want to make sure that you have very soft like amala. I don't mean to be disgusting. Soft. And how do we do this? Drink a lot of water, like 3 liters of water a day or more, because you're breastfeeding. If you're breastfeeding, and because all sorts of things are going on, there's still hormone. The fear of women with herpes stitches, beginning of wisdom. Please don't be afraid. Be strong in the Lord. Go to the toilet. Yeah. So, ensure that you've been given like good painkillers. Drink lots of water. Take a lot of fiber based foods. I mean, things like bran. If you're breastfeeding, and you're doing those treats and all that, all those granolas and things with yogurt, they are very good. So they'll make the poo soft and all that. The water will make the poo. Then the fluid you're taking will also make the poo soft. Another thing also is stool softeners. Ideally, women should be giving stool softeners routinely, but I don't even remember prescribing. I don't even remember people prescribing that. I think it's because maybe a lot of times people feel that there are things that should happen to you after you've had your baby that are part of it, and if it's painful or uncomfortable, just wing it. But that's actually not true. You should be given a stool softener. When I say stool softener, I mean things like Ducolax, things like Senna. There are some that you can insert from the back passage from under. There are also some that you can take in so that the stool is soft and you can pass this stool easily and get comfort from the stitches and get comfort from hemorrhoids. So those are things that can help with constipation. Another thing, that there are things that can make you get constipated, like iron tablets, and also there's a class of drugs called opioids. Also, they also cause constipation. So you need to talk to your doctor about it. If you're on opioids, then you want to be on a stool softener as well. But you should be given a stool softener by default, or you can get it. These are things you can get over the counter. Don't take those laxatives before when you're pregnant, because as you know, okay, exactly. Someone was giving Lactulose. Yes, your OBGYN is a human being. I'm joking. Yeah, so the laxatives can induce labor when you're pregnant, so don't even play with those things. There was a time when we used to give women castor oil to induce labor. So when they take the castor oil, they start purging, and then because the nerves are supply that lower part of your gut and your womb are like, that's why some people also have diarrhea when they are having period cramps. Yeah, so laxatives are very good. Okay, so that's about constipation. Involution after pains. So after pains are like the pain that you feel when as your womb is contracting and shrinking back to its normal size, and this shrinking back goes over like 8 weeks, but you feel the after pains within the first 3 weeks or so after, and they're like period. I mean, what it was for me was like period cramps, because as you're breastfeeding, the hormone that helps to push the milk out, oxytocin, also contracts the uterus. And I don't know if you are well, if you remember, when you even have your baby, as a routine to prevent postpartum, prevent you from bleeding excessively, actually a bit of oxytocin is actually put to help your womb to contract. That's an artificial one. Yeah, so your body also produces it. Told the midwife actually did a post on that. So So if you are already on painkillers, maybe you would want to take your painkiller at the time if it's so bad, but you're most likely going to be already covered. But if you're not on anything, the safest thing is just to take paracetamol. But if it's not catching, call your doctor. The reason why I'm saying you should call your doctor is because, like, there's some people who have ulcers and things, and there's some drugs that they shouldn't be taking. There are some drugs also that may not be safe if you're breastfeeding. So you need to just check with the doctor. Just say, let them know that you're in pain, so they can prescribe something for you for the after pains if it's that bad. Something we've always done traditionally is a hot water bottle. When I'm on my period and it's very bad, if I use a hot water bottle on my tummy, I feel good. And I guess maybe that's the basis for pressing people with hot water. But the kind of water that they press people with is in some scenarios is the type we used to take the feathers off a chicken. It doesn't have to be that hot. It doesn't have to be that hot. And then we have these packs, these Lancinol Therapel packs, which are used for helping with engorgement and mastitis, which you can heat them or you can cool them. You can also those up if you don't have a hot water bottle you can place, or you can use a towel. Now, so hemorrhoids. I tried to post a video on hemorrhoids, and for the life of me, I don't understand why it wasn't uploading. Maybe it will upload later on in the day. So hemorrhoids are actually they're actually blood vessels inside your rectum. Let me see if so in the inside of that tube, inside lining of the you have blood vessels there that I bet they act as cushions. They are also part of the things that prevent you from that allow you to control things like gas, farting and all that. So sometimes when there's a lot of pressure coming from up, for example, people who have some mass in their tummy, or for example, pregnant women who actually do have a mass in their tummy, which is the baby, so they become fatter and bulge and all that, and you can have those right in there and there's no problem, but sometimes they can sag all the way out, coming out of your let me see the picture that had the normal. You can have them sagging, and then if you look down at the rectum, so ideally nothing should be pushing out there, but sometimes these vessels now tend to push out out of the rectum to the outside, and then they can cause a lot of discomfort because they are saggy veins, and there are muscles around them. Them, they become painful. Sometimes they are itchy. Sometimes they bring out a discharge, and also when poo is coming out, especially if that poo is not soft, the poo can sort of scratch against them and then cause them to bleed. So sometimes people with hemorrhoids, depending on how bad they are, they might be when they poo, you may see blood, in their with the blood or something, and sometimes blood clots can get stuck in there and it's painful. It's really uncomfortable. It can make sitting down uncomfortable, pooing uncomfortable. But the challenge with hemorrhoids is that your poo needs to be soft, but pooing, especially when it's painful with hemorrhoids, it's quite painful with hemorrhoids. So it's very important that moms are able to sort of make their poo soft, so that if they do have hemorrhoids, they can ease that pain. And how other things that can be used to ease the pain of hemorrhoids, there are things like preparation H. Hemorrhoids can be particularly stubborn when you've just had your baby as well, and particularly irritating. So what are the things that can help with hemorrhoids? Things like sitz baths. And a sitz bath is actually from German word called sitzen, which is to sit down. And then this is like a bowl of water. It could be cold, or it could be cold, or it could be warm water, depending on what makes you feel more comfortable. And then sitting in it for like 3 to 4 times a day really provides a lot of comfort. Provides comfort for hemorrhoids, provides comfort for tears as well. There sometimes people just use the bowl, but then there's also a bag that actually should come with those bowls that you hang up, and then you can put the hot water or the cold water inside there, and then it just keeps on dripping in there. So the bowl is placed on a toilet seat, and then you sit down on it. So you can either do a sitz bath bowl, or you use your bathtub, provided your bathtub is clean. So those are the things that can help with hemorrhoids. Another thing that can help with hemorrhoids, I'm just going to show you, is let me just get back to another thing that can help with hemorrhoids is actually these are like perineal wipes. The ones that we used to have Tox. We have Medline. I'll put up, I've already put pictures of it in our stories. So this contains witch hazel, and they are wet. They're like wet wipes, like baby wipes. And how they can be used is that you can actually put them in the fridge or the freezer, and when you're changing your pads, you put the wipes on top of the pad. Let me give you an example. Let's say this was a wipe, and this is your pad. I actually have a video where I use this. Let's say this is your pad. Well, you shouldn't be using this sort of pad, you're using another type of pad. So you can have the wipes. So these wipes come like circular. There are 40 in this pack, and then you can put like 3 or 4 wipes like that on the pad, and then you use it as a compress. Place it on the pad, and then you wear it for like 15 minutes. You keep on changing it. You change your pads. Try and change your pads regularly. When I say regularly, I mean each time you go to the loo, you change your sanitary pads. Another thing that helps is this, which is a perineal wash bottle. It's a plastic bottle. There are different types of it. There's one that has a curved spout, so you can fill this with warm water, and then once you fill it, you open up this spout. Let's see. Okay. So you open up the spout. Oops. and then you squeeze the bottle. When you squeeze the bottle, you know, a spray of water comes out. Yeah, and then you can use that each time you go to the loo to prevent the stinging that comes with urination when you have those tears and that. And this is really good because it's portable. I mean, it's cheap. You can put it in your bag. If you're going out of the house, you take it out to do take it out today and all that. So this is a perineal wash bottle from Medline. So we have those available. Yeah, so those help with tears, those help with hemorrhoids. They give you a lot of relief. There are these sprays also. Olive Tree Kids actually has those sprays, Demoplast sprays, and they are numbing sprays. They are sprays that they have what they call a local anesthetic. That's like a painkiller, and then you can use that to make the area around your vagina to relieve the pain around there. What else? So those are some of the things that can help with hemorrhoids and tears. Yeah, another thing that helps in the first few days after you've had your baby, usually it's advised that you can use ice packs. We used to have some of those in stock. We just ran out like yesterday. So these ice packs, the type that's available is it's a pack, a long pack. Let me just see if I have a picture of it. If you're interested in getting those, just let me know. Just let me know. I'm just trying to get the pictures. Yeah, so these is a cooling pack. It's a cooling pack, and yeah, so that's it. So you twist it to activate the cooling, and then you apply it against your perineum. That's the vagina and anus to provide relief. One of the moms, a friend of mine, actually improvised. I've heard people who have used diapers, newborn diapers, so they open up the inside, take the inside out, and then stuff it with ice cubes, and then apply it. You know, it provides a lot of relief. It reduces swelling, because that area around the vagina will also be swollen, you know, and all that. It reduces the swelling and provides a lot of relief. I know someone who put ice inside Ziploc bags, and then applied it. I mean, I use that stuff, man. Like I use these cooling packs, and they really like. They were very very helpful. Very helpful. If you're interested in getting those Demoplast, Olive Tree Kids, she stocks them. Demoplast spray. I personally used a numbing gel. If you're interested in getting that sort of thing, so the gel was I just like it comes in a tube, so I just made a line with it on top of the witch hazel pad, and then I use that as a compress. I just squeezed out a bit of it. So each time I would go to the loo, I change my pad, I change the wipes, and then I use that. I make a fresh fresh setup. That is pad against my underwear, the perineal wipes, and then the gel. Yeah. What else? Okay, so now preventing infection. How how can you prevent infection? Change your pads regularly. The sitz bath works very well. Perineal bottle works very well. Flush, keeping the area clean, keeping your wound clean. The perineal wipes are they also contain antiseptic, but do not, like I said, it's very important that you change your regularly. Change it regularly. Don't be in a hurry to get into a pool. No douching, because what douching does is that it washes away the normal bacteria that protects your vagina and all those areas, and those are things that fight infection. And then also no tampons, because tampons, especially the ones that are highly absorbent, they can scratch the walls of a vagina, and that means that they allow the bacteria that's there to enter your bloodstream. So another thing that can help that's good is also remember to do your Kegels exercises. And Kegels is actually when you use the muscles that ordinarily would have squeezed to prevent urine or poo from coming out. You hold it for a count of about 5, and you keep on repeating it at regular intervals during the day. It also helps a lot. So we've spent like an hour talking. I hope this was very helpful. If you have any questions, please send me a direct message. It's going to be up for 24 hours. I'll put it on YouTube much later, and then I'll put the points up on my stories. Thank you so much. Bye.